This is McCollum. I've voted for you in the past. I attended my Democratic precinct caucus this year. I'm telling you right now, though, I do go to Tea Party meetings because I'm extraordinarily concerned about this debt that's choking our country. I am grassroots. Real grass from my backyard. No one sent me. No party sent me. No company sent me. It's just me. And I believe, first of all, I would really like to ask you to talk to your House leadership and tell her to apologize to people who disagree with her and not call them evil mongers or Nazis or any of these other crazy things that have been called simple people like us who are concerned. That's number one. Number two, someone else actually addressed one of my concerns. It was about preemie babies. I'm very concerned about the big hit seniors will be taking, huge hit. But I'm also concerned about infants because of having read about what Zeke Emanuel, who is one of Obama's top medical advisors, believes about who should take top priority in getting medical care. He believes people between 50 and 40 years should get top priority, whereas young infants and very elderly people would be second. Okay, my question for you is, what will you do, because lots of bills sound wonderful when they're written, to assure that they are carried out by regulators? We don't elect the regulators, we don't elect the czars, but we need you to make sure these outrageous philosophies aren't carried out and it's working for us.
Hi, my name is Ken Engelhardt, and I want to thank you for your support of public option, and thank you for supporting the Obama plan. I'm a physician. I was in private practice for 25 years before joining the VA medical system 3 years ago. And I've experienced both sides, the private and the public sector of healthcare. I think our healthcare system is dysfunctional. 1/3 of our premiums go to marketing, competition, paying the multi-million-dollar salaries of CEOs, and scouring our medical records to find reasons why we should not receive health insurance. The VA system is the best system in the country. You don't have to take my word for it. I encourage you to read Best Care Anywhere by Philip Longman, and it'll tell you why. I'm happy to be at the VA. I think the federally run system in the VA is excellent, and I'm proud to work there. I would encourage a system like that for all Americans. Thank you once again.
All right, 62, 295, and 55.
Hi, Representative McCollum. I'm Wendy Roush, and I live here in St. Paul. And I'm one of those many, many people that was downsized from a Fortune 100 company. And I had pretty good health insurance. As time went on, the health insurance premiums were getting bigger and bigger, but it was still a great opportunity to have that coverage through a company. When I no longer had it, I needed to look elsewhere. And I did find it through a contractor. I have part-time insurance, or more minimal insurance available to me. But as I went online to look, I found options that really aren't talked about very much. Accessibility is really thrown around a lot. There's some, healthcare is inaccessible to a lot of people. And what I found on several websites was that really major local providers are offering coverage from $60 a month up to several $100s a month. all of which are far more affordable than the COBRA mandated insurance by the program by the government. You choose who your provider is, you choose your deductible, you choose what you want to spend per month, and I think that's accessible. You don't have to be a wealthy person to afford that, and it's certainly far more appealing than having a government program where I don't make the choices, but a panel makes the choices for me. And I think, continuing on that, the 3 providers that were listed are really major providers. However, imagine how much better it would be if we'd open up the borders of competition and you could go to providers that are outside your state. Because right now we can only go to providers that are within our state. And if they could market to us and we could have the choice to go to them, it would bring costs down and make it more affordable.
Representative McCollum. I have a question for you. I'm sorry. Okay, my name is Dave Johnson. I'm from Maplewood. And my question is, going forward, what do you think our quantitative measure of success would be? And we have many of them, whether it's longevity or cost or... anyway, I'm just looking for a kind of a quantitative answer, because once we agree on that, everybody in the room, then we can move forward and make sure that that happens.
Well, I do believe that everyone has the right to health care. And let's start with children. I believe every child in this country should see a doctor when they need to see one. It shouldn't be tied to whether or not their parents have a job. It shouldn't be tied to that at all. And so if we start early with children, so I'll count that as a success when we cover all of our children. And then another thing that I think should have been taken care of properly when I was serving in the minority in Congress, I didn't vote for Medicare Part D. I think every single year shouldn't be worried about affording the prescription drugs. And even with Medicare Part D right now, we have far too many seniors and people with disabilities that still, yet to this day, cannot afford their medications. And when they don't take their medications right, they land up in the emergency room. They land up being hospitalized, and that's more expensive for us, and it reduces their quality of life. So those are 2 real quick short-term goals that I want to work on immediately when I get back.
Representative McCollum, thank you for being here tonight, and I very much appreciate the words that you've given us so far. My name's Eric Lampland. I live here in St. Paul, just a short distance from here. I am one of the many underinsured people that you spoke of on part of your 60,000, if you will. I've had a consulting firm for about 12 years, and it's a small consulting firm and it deals with leading edge technology, so it'll always be small. We don't have a large market to go after. And in pursuing that particular interest of mine, I've only been able to afford insurance that has large deductibles. I carry a $15,000 a year deductible on my policy. This is something that nonetheless has cost me well over a few $1,000s a year and increases 20% or so a year and has for the last 12 years. I don't really enjoy those increases much, and I'm sure most of the other people here don't, but I live with them. That I can handle. The fact that in this same period of time I've had a stroke, which was entirely at my own expense, and most recently I had skin cancer, which was also at my own expense, is something that I bear, that I have to put up with. That's what this system is all about. What is still tragic, however, for me is that I can't get information from my insurance company or from my doctors as to the expense of any procedure that I was just going on. The skin cancer that I had this summer took 4 months